Our next big story, in-depth coverage on a major potential hospital merger affecting Rhode Islanders. Care New England announcing today it wants to merge with South Coast Health Group. And WPRI.com reporter Ted Nesi has been tracking this story. Ted, did today's announcement come as a surprise?
You know, I think not really, Shannon, because Care New England, which of course is the parent of Women and Infants Hospital, among others here in Rhode Island, you know, ever since they bought Memorial Hospital in Pawtucket in 2013, they've been having some financial challenges because that hospital had some debt, etc. And so Care New England had been saying for months they were looking for potential partners. It could have been a merger, could have been something smaller than that. So this news today, you know, we knew something was probably coming. But the fact that it wasn't Lifespan, the other big hospital group around, which they've been pushed to merge with before, was a little bit of a surprise.
Any other hospital groups they've considered merging with?
I talked today to Care New England CEO Dennis Keefe. He told me it was Lifespan, South Coast, who they want to merge with now, Partners, which owns the Brigham and Women's up in Boston, and Prospect, which owns Charter Care, which has a bunch of hospitals as well. So they looked at all those, but they said they didn't see anyone else who would give them the level of partnership that they wanted, and that's why they chose South Coast.
Okay, now obviously tens of thousands of people work for Care New England and for South Coast. So what would this mean for the jobs at both organizations?
It's kind of counterintuitive, but Dennis Keefe, when I talked to him, said he actually thinks there could be job growth with this merger, which he said wouldn't have been the case if Care New England had looked to merge with Lifespan or one of the Rhode Island groups, because there'd be so much overlap. He said South Coast and Care New England's networks are kind of next to each other, and because of that, they think they'll not only need the same people for the most part that they have now, but even add some folks in primary care and population management. So he's putting a very happy face on this.
Did he give you any idea of when we'll kind of know what's
They've
going
given
forward?
themselves 90 days to come up with a formal merger agreement, and then he says it could take 6 months to a year if everything goes the way they want to actually put together the new group that would run the whole business, all the hospitals that they have.
All right, WPRI.com reporter Ted Nesi, thank you so much. And you could